name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with fertility and pregnancy, the infertility. But before I do this, I want to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, and hair, then conditions of the eyes, ears, and nose, then ailments of the teeth and gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, then homeopathic remedies on infections, infestations, and the immune system, then issues surrounding fertility, pregnancy, and surrounding childbirth and postnatal problems, then homeopathic remedies that address special problems of infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, gangly, and of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with fertility and pregnancy, infertility. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counted from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tender or swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and some loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkup care. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal, or if there's a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise such as swimming and walking in the fresh air are very good, but anything that involves repeated compression of the spine, such as horse riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious travel if you can, especially if you have had a threatened miscarriage or there are complications or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop work before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medications if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores, and health food shops. There is no evidence that hormone therapy, homeopathic remedies, cause any problems during pregnancy. But to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It is possibly best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything. Infertility. If you have been having regular unprotected intercourse for 12 months and have not become pregnant, you or your partner may be infertile. Infertility is quite common. 1 in 8 couples, researchers say, although a recent doctor survey put the figure rather lower, at 33% of 35-year-olds, and in most cases can be traced to a specific problem in the woman or the man. Female infertility. Female infertility may be due to damage to the uterus, from infection or fibroids, to retroversion of the uterus, or to the presence of a wall or septum in the uterus. A congenital defect. Mucus produced by the cervix may be too viscous for the sperm to penetrate, or it may contain antibodies that kill the sperm. One or both fallopian tubes may be blocked as the result of gonorrhea, endometriosis, or tuberculosis. One or both ovaries may be affected by ovarian cysts or endometriosis and fail to produce the necessary hormones, or chronic ill health. Stress or emotional trauma may depress production of follicle-stimulating hormone. The hypothalamus, and so prevent eggs maturing in the ovaries. Investigation is made by physical examination initially, at which time a full medical history will be taken. You may also be asked to keep a temperature chart. A slight rise in temperature in mid-cycle indicates that ovulation is occurring. If ovulation is not the problem, the next step is to take a sample of semen from your cervix shortly after intercourse to see what effects your cervical mucus has on the sperm. If this is not the problem, you will be given blood tests to check hormone levels, followed by x-rays and a small operation to see if your fallopian tubes and ovaries are normal. Specific remedies to be taken every 12 hours for up to 7 days while waiting for constitutional treatment. Breasts are tender with areas of hard swelling. Desire for sex is suppressed for some reason. Use Conium 30C. Tenderness in the lower abdomen over right ovary, dry vagina. Use Lycopodium 30C. Previous miscarriage before 12 weeks. Use Sabina 30C. Irregular periods. The womb feels as if it's about to drop out of the vagina. Feeling chilly, weepy, and irritable. Aversion to sex. Use Sepia 30C. If a pituitary problem has been diagnosed, take Agnus 6C up to 3 times daily for 3 weeks out of 4. If your periods are regular, stop during the week of your period. Male infertility. Male infertility may be due to low sperm count caused by the mumps, too much heat around the testicles, varicocele, steroids, drugs, alcohol, excessive smoking, lead to lead or carbon monoxide poisoning in x-rays, or sperm may be deformed or unable to swim vigorously. Testicles or vasa deferentia may be damaged by gonorrhea or syphilis. Stress, overwork, tiredness, and psychological factors can cause erection problems and ejaculation problems. Diagnosis is by a physical examination and history taken. A sample of semen will be needed to check sperm numbers and quantity. If no sperm are found, a testicular biopsy, which is an analysis of a small sample of tissue from the testes, may be necessary. Specific remedies to be taken every 12 hours for up to 7 days while waiting for constitutional treatment. Ineffectual erection, lack of energy, absent-mindedness. Use Agnus 30C. Inability to sustain erection, cramp and coldness in legs. Use Conium 30C. Increased desire for sex, but intercourse spoiled by anticipation of failure. General insecurity. Use Lycopodium 30C. Dragging sensation in the genitals. No desire for sex. Use Sepia 30C. Self-help. If infertility is due to low sperm count, try to abstain from intercourse in the week leading up to ovulation. This will allow sperm numbers to build up, increasing the chances of conception. Orthodox treatment of infertility is by drugs to ensure ovulation, increase sperm production, boost certain hormones, and suppress others. There are also various implantation techniques. Occasionally, such drugs result in multiple pregnancies. Some abnormalities can be corrected by surgery. Otherwise, the options are artificial insemination or test tube fertilization, both of which require careful thought and considerable effort and commitment. Before embarking on orthodox treatment, try nutritional therapy and constitutional homeopathic treatment. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.